Hello, this is Miss Philippi. I will be your clinical instructor for RNSG 1950, the mental health course. I want to go over your clinical paperwork. This is your part of your orientation. I'm going to start with the clinical guide, then I'm going to go over your clinical paperwork as well, what I expect you to turn in. So you will be going to Archibald North Side for one day from 7 a.m. to 5 p.m. We will leave Archibald North Side about 3 o'clock in the afternoon, and we'll return to the college here in Thomasville to complete the paperwork. And then you will also be going to a virtual hospital day. Dr. Burt will get you the orientation. She'll come see you or send you something for the orientation for that. And then you will also go to Colquitt Regional Behavioral Health on the second floor at Colquitt Regional Medical Center. And you'll be going there from 6:30 a.m. to 5 p.m. Your clinical paperwork will be the same for Colquitt Regional and Archibald North Side. So I'll show you that at the end of this orientation, but I'm going to go over your clinical guide for now. So our clinical guide focus, of course, is the introduction of theory and practice in mental health nursing, treatment modalities for clients experiencing transitions in mental health, moderate to severe mental health transitions throughout the lifespan, emergencies in mental health, severe to psychotic mental health transitions throughout the lifespan, and the needs of children, adolescents, and older adults in mental health. We have our EOP SLOs like we do in every course, and they are professional behaviors, communication, collaboration, assessment, clinical decision-making, caring/nursing interventions, managing care, providing care, and teaching and learning. Clinical attendance is very, very important. We have a very, very short semester, summer semester. There is no time to make up. I make the schedules and we are packed. So please do your very, very best to be there. I understand emergencies happen. I understand illnesses happen, flat tires happen, but please always have a backup plan, okay? Have another ride if you walk out at 5:30 in the morning and your tire's flat. Have a backup plan. If you have a sick child, have a backup plan. Make sure that if you do miss clinicals, I need an excused absence emailed to me within 24 hours. I'm also the clinical coordinator for our ASM program in Thomasville, so you can email me here at this address, or you can do the lphilippi@southernregional.edu. They all come to me, but I have to have that excuse in order to schedule your makeup day. You will have to make up the entire 10-hour day if you miss it. Our clinical objectives. So, of course, utilize communication techniques. Communication is going to be very important in mental health, therapeutic communication. You need to be able to identify psychological changes in your client. You need to assess them as far as safety and psychosocial needs. Justify your care, prioritizing your care according to their needs. Determine their goals for the diagnoses. Choose interventions to meet their goals. Evaluate their goals. Take legal and ethical principles related. Value legal and ethical principles related to nursing. Take part in a report. So listen to a report, and at the end of the day, I want you to be able to give an S-bar to that client's primary nurse before you leave the site. You will complete documentation, but you will not complete any EHR. We won't be documenting at Colquitt or Archibald North Side for these visits. It will only be the paperwork that you're given. Clinical evaluations. The CET, clinical evaluation tool, will be used, and you must score at least a 70 or greater to earn your satisfactory for that part of the clinical course. You have to receive an S in order to be successful in the didactic, the lecture part as well. If you don't pass clinical, you don't pass the course. Okay, so please do what you're supposed to do when you're supposed to do it. Like I said, you will go to Archibald Northside one day, you will go to Cockwood Regional Behavioral Health one day, and then you'll have a virtual day here at the college with Dr. Burke. An unsatisfactory U grade will be automatically given if there are any incidents of gross unprofessional conduct or behavior at these sites. It's very important that you take this serious. These are mental health patients. So your safety is the number one priority. Please don't become friends with these people outside of nursing school. If you see them in town, do not put them up in a hotel and buy them groceries. And I say this because it's happened. It's very important that you remain professional in all aspects of your relationship with these clients. Civility statements. So you don't have a civility journal in this course, but I will list it here. Of course, you promote respect and kindness and a positive and collaborative atmosphere to all of our clients, that you don't have to do the civility journal. You will do the SBAR, Situational Background Assessment Recommendation Tool, as part of your clinical paperwork, and I'll show you that in a second. And it's introduced in these courses. Clinical simulation lab requirements. Dr. Burt will get with you on her requirements for this, but it's also listed here. If you have some type of personal issue that you need to discuss with me, let me know that ahead of time where I can be aware. You are responsible to abide by all the rules and regulations of any clinical facility that we use for clinical rotations. Of course, transportation to and from these sites are your responsibility. You cannot give care before or after we leave that site to the patients, okay? It's your responsibility to follow these objectives. You must maintain safety. You are expected to communicate with staff and nursing personnel to let them know and let me know about your client if anything were to happen. We maintain strict dress code. So when we get to Archibald Northside, I will be covering up your last name on your name badge. It's very important that you maintain that confidentiality, okay? Social media is wide open, and I don't want a client to see your name and try to send you messages on all the social media sites, okay? When you report to clinical, you should have copies and extra copies of your clinical packet that we'll go over. Make sure you make about 20 copies of your medication form that's in the packet, because there's only one in the packet that you'll be given. And if the client has more than one medicine, you need more than one sheet. You're welcome to make a list of the medicines, but I would take those in case you need those and want to go ahead and get those done and turned in. Make sure you always have a few extra copies of these packets. They will be listed in Blackboard as well. Make sure you always come prepared. We won't be taking any bags, suitcases, purses, big clinical bags into these sites. Okay, this is for your own safety. You will take your a paper folder with your clinical paperwork in it, and you will be taking a pen or a pencil. Okay, you can bring snacks, but make sure you understand that this, again, is a mental health facility. You don't want to be bringing in things that can be used as a weapon. Absolutely no cell phones in this facility, in either facility, Cockwood or Archibald Northside. You don't want for that to get stolen, swiped by a patient, or misused. Okay. You will not be given any medications, and like I said, you will not be charting on their electronic health system. This is the list of clinical paperwork that you'll be doing, and I'll show you that in a second. The SBAR, the assessment guide, medications, labs, diagnostic tests, and then your interpersonal record. And then we have a new concept map that I'll be showing you as well. If for some reason that you do not have a client, you will be completing a journal entry, 2 to 3 page journal, and the specific instructions are listed here. There may or may not be a Dropbox on Blackboard. I'm just gonna tell you to turn it in like you would your normal paperwork. So Miss Pearson will have a folder, and you turn that paperwork in to her on Monday. So if you finish your paperwork with me, like I said, you can turn it in to me the day that we go to Northside if you get done by 5 o'clock. If not, then turn it in to her on the Monday immediately following your clinical experience. Now you will have another journal, just a paragraph journal that you will do if you have a client, but I'll show you that. But this is different, so don't get those confused. This is only if you do not have a client, okay? And it goes on. You must have 3 references with APA format. The references don't need to be any older than 5 years. And there's some more guidelines, same guidelines. Professionalism is extremely important, especially with these mental health patients. So let me show you the paperwork. So you'll start out, and I'm going to do my very best to get us a face sheet and an H&P, so you can have the information off of that. But the assessment guide, the history and assessment, history and background, like social history, family history, medical history. You just complete this whole packet here. Okay, this is your 1 copy of medication form, so that's why I'm telling you need to make some more copies. If you're able to get lab diagnostic sheet, you can complete this. And this is your S-bar, so go ahead and write down what you'll be doing throughout the day, and that way you can have it in your hand, not to read from it, but just to reference it when you're giving a report to your nurse. Okay, this is your interpersonal record. You'll complete this, and this is the journal entry, like a recap, just a paragraph recap of what you observed, communication, and things you learned about your day. So with a patient, you'll be completing this. And then National Patient Safety Goals, this is only done once. So if you do it at Archbald, Northside, you don't have to do it at Colquitt, okay? And then you'll also have this clinical judgment. So this is the new form. You just come up with a disease process or an issue, like it could be schizophrenia or manic depression, and you fill it out just like you did the big ones that we used to use, okay? Your indirect supervision form is here. If you go to Colquitt without me, you can give this to the nurse, the charge nurse or the staff nurse for your patient, and let them know what you can be doing. I'm fine with you doing vital signs and transporting patients, but you just need to always remember safety. You can email me if you have any questions. Let me know that you understand it. And I will see you soon. Thank you.